Hello and welcome to today's episode of the Men's Health Hub, where we are shedding light on balanitis, a condition that affects the glands or the head of the penis. It's often accompanied by discomfort, irritation and swelling. Now, whether you're experiencing symptoms or simply want to learn how to prevent this common issue, we've got you covered. And we're going to explore what causes it, how it's treated and how it can impact overall sexual health. So first and foremost, what is balanitis? So it's an inflammation of the glands, often extending into the foreskin in uncircumcised men. Don't be fooled, you can also experience this if you have been circumcised. Now, it's a condition that usually isn't serious, but men have a tendency not to want to go and get this seen to or to talk about it. And yet it can really cause significant discomfort, and if it's recurrent, it can indicate underlying health concerns like diabetes or infections. So it's something you don't want to sit on, it's definitely something you want to go and have seen. It's more common in uncircumcised men. Anyone can develop balanitis under certain circumstances. So what are the causes of this? Well, the main culprits include poor hygiene. So an inadequate cleaning under the foreskin can lead to an accumulation of smegma, which is such a wonderful term. And it's a substance that can irritate and inflame the glands. So now you will never be able to look at a smeg fridge ever again. Infections, we're going to look at fungal infections. So there's a fungus called Candida albicans, which is particularly common with balanitis. And then there's bacterial infections such as STIs that can contribute to this. And then there are irritants. So harsh soaps, detergents and personal care products can cause an allergic reaction or irritation. And if you've been using harsh soaps while masturbating, then obviously that's going to exacerbate that problem. You can have allergies. So if you have a latex allergy and you've been using condoms or a lubricant, that can also exacerbate the issue. You can have medical conditions. So I mentioned diabetes earlier, and that's a significant risk factor due to the higher glucose levels, which creates then an environment for infections because bacteria and fungi love the high sugar load. And then there's a condition called phimosis. Now, there will be a separate talk on phimosis, but this is to do with a tight foreskin that can trap irritants and bacteria in underneath the foreskin, increasing the likelihood of inflammation. Other causes can include friction from sexual activity or from tight clothing. You kind of wonder what all of those 80s pop stars might have got up to. And then the autoimmune conditions like psoriasis or lichen planus can sometimes lead or make you more prone to this condition. So what are the symptoms with balanitis? So the symptoms are generally redness and a swelling of the glands of the penis. There can be itching and there can be burning sensations. Some might say that they experience pain and discomfort, particularly whenever urinating or if involved in sexual activity. There can be discharge, and the discharge in this case will probably have an unpleasant odor, and there can be difficulty retracting the foreskin in severe cases. Now, the symptoms can impact sexual health and cause anxiety. It can cause discomfort during intercourse, and it can really impact libido. If it's left untreated, it can lead to complications such as scarring or this condition known as phimosis, which is this tightness of the foreskin in and around the penis, and it may require then surgical intervention. So better to get it seen to than to wait for the surgery. Now, when it comes to conventional treatments, balanitis is generally treated with topical creams such as clotrimazole, miconazole, and commonly prescribed fungal infections. They might give you an antibiotic. It would be oral and topical antibiotics in this instance. You might be given steroids to reduce the inflammation in and around the glands of the penis, to reduce swelling and discomfort. And they might want to talk about underlying causes such as managing diabetes or treating the phimosis if it's recurring. They may even recommend circumcision if it's recurrent or severe. Now, the pros and cons of circumcision briefly. So circumcision is often suggested for men with recurrent balanitis, and it's a personal decision. You've got to weigh the pros and the cons for this. The pros are quite clear. It eliminates the risk of balanitis and the related foreskin issues like phimosis. It can really simplify things with hygiene, and it reduces the risk of infections. And sometimes women will actually say that they prefer a man who is circumcised to a man that's not. It can also lower the risk of some STIs, including HIV, and that's according to the Lancet. And it can reduce the risk of penile cancer, although penile cancer itself is really quite rare. Now, the cons of circumcision. There's surgical risks such as infection, bleeding and scarring. There can be the loss of foreskin, which can reduce sensitivity for some men. Again, if you have been circumcised from birth, you'll not notice any difference, but for people who've been circumcised later in life, they do feel that the sensation's slightly different. And it's irreversible in nature, though there's some people who would claim that they're able to grow back their foreskin. So it's something you want to consider. So for men who experience frequent balanitis, the benefits of circumcision is probably going to outweigh the risks, but the choice is deeply personal and it should be discussed with a healthcare provider. Now, when it comes to natural and functional approaches, in addition to the conventional treatments and the natural remedies and lifestyle adjustments that can play a role, you want to really focus in on how to clean the penis. So gently cleaning the penis and the foreskin daily with warm water and a mild fragrance-free soap, and ensuring that the place is dry thoroughly after. Mold bacteria like a wet, moist climate, and ultimately what we're trying to do is remove that as much as you can. So you don't want to be rubbing, you don't want to cause any damage or any irritation to the area, but you do want to just make sure that you are gently cleansing and retracting the foreskin so that you're able to clean the head of the penis adequately. Now, herbal remedies. Fundamentally, whenever it comes to balanitis, what we're going to be doing is trying to focus on the antifungals and the antibacterials. So the three big hitters here: aloe vera as a gel is really, really useful as an anti-inflammatory to help soothe irritation. Calendula is known as an antifungal. It's anti-inflammatory and it can help heal minor injuries. And then tea tree oil, which is really potent as an antimicrobial. However, I personally would not be one to be using tea tree oil on my penis. I think it would sting. So even if it was diluted, it's just not what I would naturally go for. There are other things that might be beneficial. So yarrow, there's a number of mushrooms that are helpful. There's some antibacterials such as alcornia and cryptolepis. Andrographis is a very strongly antimicrobial herb and bitter that could be used topically. The herbs golden seal, Berberis vulgaris and Berberis aquifolium are all herbs that contain berberines, and berberines are 100% effective with Candida albicans, so there's definitely evidence to suggest even that as a tea and bathing the head of the penis in it would be really quite useful. You might want to boost the immune system internally with herbs such as echinacea or reishi mushroom. And there are numerous other herbs that we would use to try and fight a candida infection. Now, when it comes to nutrition, I'd really recommend anti-inflammatory foods. So these are things like berries and leafy greens to help support the immune system. And then probiotics such as yogurt and fermented foods, which interestingly, in females that have thrush, which is Candida albicans, I would suggest using natural yogurts internally and vaginally to try and get the mucosa and the bacteria right on the mucous membranes. The same would apply for the head of the penis. You could actually dip the head of the penis into the yogurt, obviously not before you're eating it, or to take some of the yogurt and actually massage it around the head of the penis to try and restore an appropriate microbiome to the head. Lifestyle adjustments. So avoid harsh soaps and avoid tight clothing. Use hypoallergenic condoms and lubricants to reduce any irritation that you might be having. Tips for preventing. probably doesn't take a genius. Good hygiene to manage any kind of underlying issues such as diabetes, making sure you're looking after yourself well and on a good low sugar, low carb diet. You want to try and stay hydrated and ensure that you are going to the toilet often enough, and ensure that you're practicing safe sex. It's manageable with the right care and attention, with improved hygiene, natural remedies and medical treatments. It is better to get a diagnosis of this earlier rather than later, so if it is something that you're concerned about, it is well worthwhile making an appointment either with myself or another health professional to actually talk through what you can do to help treat it. Hopefully that's helpful for you, and I'll see you at the next one.